You know, understanding the individual is important as much as you can with what they're willing to share, what they're able to explain is important. And, and my ability to really create a safe place for them to talk about what matters to them. Being curious, being respectful, understand that they might have a very different worldview about what we're talking about. And my sincere desire to understand that, not to push my view onto them or to influence them unduly, but to understand what's important to them. And you know, families differ. What one individual will do for a loved one or what someone might think is important could really surprise me. I could disagree with it. But that's the way they see the world, what they see is important to them. And so part of it is getting to know them as much as I can as an individual, asking questions, showing that I'm really interested in understanding what matters to them, and knowing that my life experience that shapes my culture and values might be very different from theirs. So we think about, in terms of the ethics framework, you know, we respect an individual's right to decide. Some of the other tools we use, we call narrative ethics. You know, how do we understand an individual's story? You know, you might ask a patient about their diabetes and you want to really know about what's happening this week, and they start talking about their Aunt Catherine who had diabetes 30 years ago. Well, there's a reason someone's sharing that. And so listening for understanding, why did they bring up Aunt Catherine? What about her diabetes experience is informing what they think is important? That maybe the treatment isn't going to help, or there's some outcome that they fear that I'm not even aware that they're thinking of that. So we do think about the patient's narrative. We sort of call that narrative ethics. We talk about relationships, so care ethics. You know, how do we understand the relationships that are impacting an individual and why they are making a certain decision or asking certain questions that to us don't seem to relate. It might be involved with their relationships with their family or with work or whatever is going on in their life. And it's invisible to me. So unless I create that safe space for them to share something that will help me help them with their healthcare needs.